Welcome to Introduction to Walk-In Centers. This quick course is intended for all first responders and provides an overview of the services available from the Colorado Crisis Services Walk-In Centers. We created this course so that first responders like you are aware of benefits that walk-in centers offer and can share this information when you encounter people in mental health crises and their family and friends. Let's get started. Take a moment to review the course objectives in detail.
Thanks for getting here so quickly. I'm really worried about her. She's been really upset since her mom died, saying she wants to join her, and, well, I just don't know how to handle it.
I understand. You did the right thing by calling. What's your friend's name?
It's Shauna.
Hi, Shauna. I'm Officer Jameson. It looks like you're having a tough time. Would you like us to take you somewhere, like a hospital, to talk to someone?
No. I can't go to the hospital. Not after what happened to my mom. I just can't.
It's okay. Don't worry. We'll figure something else out. Okay, she's refusing transport, but she needs to see someone and get some help. What are our options?
I think I heard something about walk-in centers for people in crisis. Let me see what I can find out.
A walk-in center, or WIC, is a safe harbor for people in crisis who need immediate intervention from trained professionals. WICs offer mental health triage and intervention for people experiencing substance use, suicidality, depression, and other challenges. WIC staff are trained and experienced at handling mental health crises and typically better able to handle these situations than an emergency room. You can assure the person in crisis that their visit to the WIC and whatever transpires there will remain confidential. The walk-in centers aim to remove barriers that keep people from getting the help they need. As the name suggests, anyone in crisis can simply walk into a WIC with no appointment required. Walk-in centers are open to everyone, regardless of their place of residency or ability to pay for the services. The WIC will not request payment or co-payment at the time of the visit, so finances should never prevent anyone from taking advantage of this service. If an individual has private insurance, they may be responsible for a co-pay at a later date. Language should also not be a barrier. Some walk-in center staff speak Spanish, and all centers have access to translation services for more than 200 languages. WIC services are open to people of any age, but youth under the age of 12 must be accompanied by a parent or guardian. Otherwise, WIC staff will need to get consent from a parent or guardian before they can assess the youth or provide referrals to any services. Youth aged 12 and over are legally able to consent to outpatient mental health services on their own. However, the youth should anticipate that the crisis specialist will encourage the youth to involve at least one adult in their support system. WIC staff also need to contact a parent or guardian if the crisis specialist determines that there is imminent risk to the youth, or if the youth is under the age of 18 and needs to be admitted to an inpatient facility. When a person in crisis arrives at WIC, they'll meet with a trained crisis professional who will conduct a crisis assessment to evaluate the immediate need. The WIC staff will determine what treatment is appropriate, as well as any additional supports or referrals to services that will help going forward. During the visit, the WIC provides a safe space for individuals in a behavioral health crisis to de-escalate. They will receive support to get past the immediate crisis, such as substance use disorders, psychosis, or thoughts of suicide. The WIC is an outpatient treatment center only. In some cases, the WIC staff may determine that the individual in crisis requires more intensive services, such as admittance to an inpatient facility, crisis stabilization unit, or respite facility. In those cases, the staff will coordinate with the receiving facility and, depending on need, either arrange for behavioral health secure transport, or if the person is there voluntarily, arrange for a member of the person's support system to transport them. The WIC will conduct a warm handoff so that the individual is known and welcomed at the next facility. There are 11 walk-in centers distributed across the state in the Metro Denver, Northeast, Southeast, and Western Slope regions. Each center is open 24 hours a day, 365 days a year. To find the center nearest to you, visit the Colorado Crisis Center website, 988colorado.com. There, you will find both a map view and a list view showing the location of each center. You can also search for a center by zip code. The Behavioral Health Administration has created a flyer that you can use to refer individuals in crisis, their families, and their friends to a WIC. It is an easy reminder that help is available in many forms, including walk-in centers, calling or texting 988, or chatting online with a crisis professional at 988colorado.com. Take a moment to explore the 988 Colorado Mental Health Line resources page for additional downloadable and printable mental health resources. And make sure to use the link provided to order your free printed 988 support materials from the BHA so you can leave behind important resources for those in need. This concludes our introduction to walk-in centers in Colorado. Now, you know that there is an alternative for people in crisis to find immediate, trained, and caring support. To recap what we've discussed here, walk-in centers offer free, multilingual, 24-hour crisis services to people in need. They perform triage, intervention, and warm handoffs if more intensive care is needed. It's a good idea to locate the WIC or WICs nearest to you now, so you know in advance what your options are. If you're not able to take a person in crisis to a WIC in the moment, you can let them know that the services are available. Leave the flyer with the individual, a friend, or a family member so that when they're ready, they know where to get the help they need. Congratulations, you have finished this course. You may now close your browser.